Talk fans, let's continue on our journeys in urine culture. Today is about urine plating and place examinations. I will talk about the types of medias and why these medias are selected. Without further ado, let's get into it. Previously, we talked about how urine should be collected and transported to laboratory. Now, let's say we have an acceptable specimen in our hand. What do we do next? First, double-check patient name on the specimen cup and doctor order. Let's say the doctor ordered urine culture for today's purpose. Common media for urine culture are BAP and MAC. Plate. Like I said, one of the common media is BAP. What's BAP stand for? BAP is a blood agar plate. Sometimes people just refer to it as BA. BAP can grow most of bacteria and can be used to determine hemolytic reactions. BAP for urine culture can be incubated at 37 degrees oxygen incubator for 24 hours. Another common media used is MAC. MAC stands for McCogging plate. This is a selective and differentiate media. It is selective for gram-negative bacterial growth and allows CLS to distinguish various gram-negative bacteria based on lactose fermentations. This plate can be incubated at 37 degrees oxygen incubator for 24 hours. The selective property for this plate comes from crystal violet dye and biosalt, which prevent gram-positive and factitious growth. Lactose that is in this media is what gives the differential property to this MAC plate. Bacteria that can ferment lactose, forming lactic acid, would decrease the pH of the agar and turn the phenol red, which is the indicator of the agar, to pink. This process helps us differentiate between lactose fermenter and non-lactose fermenter. Pink colony equal to lactose fermenters and non-pink colonies are non-lactose fermenters. Supply. Use sterile plastic disposable lube, commonly used in the laboratory nowadays. Beside the lube, we just need the plate, and we can get on plating for urine culture. That's how simple it is. But when it's come to streaking urine plate, there are different ways to streak a plate for urine culture depending on the specimen's collection methods. I'll show you how to streak urine plates for random midstream collections because that's the most common one. How to streak urine culture plate from midstream collection method. Streaking urine plate is different from other type of specimens. First, you have to mix the urine thoroughly. Make sure that you don't have any sediment down on the bottom. And then use your sterile urine loop, dip into the urine. Just dip the loop part, not the whole stick, because the loop is already calibrated for how much specimen you're going to pick up. If you dip in the whole stick, then you're picking up more than what you need, and that can increase the CFU, colony forming unit, and throw off your reading later on. After you dip your loop into the urine, draw a line straight down in the middle of the plate and go over it with a zigzag pattern until you cover the whole plate. Before you start streaking the plate, take a second to look for any signs of contaminations or mislabel. Plate examination. This is when it gets exciting because you see the stuff that's going on the plate. Step 1. Exam culture media that have been incubated overnight or at least 18 hours. Step 2. There are conditions that we will re-incubate the plate after initial checking. Re-incubate the plate for 48 hours if the following is true. Further follow-up for positive culture. What counts as positive culture? How many CFU would be considered pathogenic? It is not as easy as seeing something growing on a plate and you can call it a positive culture. Our skins have a normal flora, including our genital area, which could easily contaminate the specimen. That's why it is very important to follow the specimen collection procedures. How to count CFU. Determine the colony count for each morphology type in the media separately by looking at both BAP and McConkey plate. There are some organisms that would grow in BAP but will not grow in McConkey, and there are some that would go on McConkey but not BAP. So you will have to consider both type of medias and be careful not to leave out clinically significant pathogen. Do not identify normal flora. This is a big fall for new CLSs. A lot of new people would try to identify everything, but the thing is that's not necessary. There are organisms that would consider normal flora and doesn't cause you any harm, so we will not need to identify and perform a sensitivity test on those. Now, I have a few plates for you to look at. Would you say this plate is normal flora or pathogenic? Subculture. At this point, you have identified whether or not you have a pathogenic organism present on your plate. Next is to subculture and get isolated colony for each organism that you see on your initial plate. And the isolated colonies can be used for ID and Sensi later on. Subculture incubation. The subculture plates are to be incubated at the same optimal temperature as the initial bacterial growth, unless you suspected yeast or fungus. Specimen storage. Other than incubating the subculture plate, we would hold the positive plates for 2 to 3 days at room temperature for further workup if requested by the physicians. In a high-volume hospital, holding onto urine cups in refrigerator for 24 hours may not be possible because of space limitations. Instead, we could transfer urines into a gray top tube with preservative to prevent overgrowth. Blood talk fun time! If staph aculotidae are identified for females in childbearing age or from diabetic patients, always report findings regardless of the count. Staph aculotidae is leading cause of infections in postpartum diabetes and neonate sepsis. That's all I have for today. Did I miss anything? If you have any questions, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!